Is that okay? Great. It's okay if I stand this side? Okay, hello everybody. I'm Thomas Hone, I'm from Imperial College. I'm here also on behalf of my boss, Professor Christopher Millett. He does a lot of work on austerity and recession, and unfortunately he can't be here today due to a family crisis, and I'm stepping up a lot of work that I've also done looking at health systems in Europe. So hopefully this should give you a little bit of insight into some of the experiences that happened in Europe and happened in the last sort of 10 years, and hopefully try and draw some tangible lessons for the Latin American setting and the influence on universal health coverage, health outcomes, and inequalities. Oh, we've got rid of it. Other way. Down? Okay, so the financial crisis, we can kind of split up the financial crisis and the recessions in Europe and Latin America because they are sort of slightly distinct. So in Europe, it was the first wave of the recession which started in 2008. And this was really due to the effects of the subprime mortgage crisis in the US. A lot of the UK and big financial industry in Europe was exposed very heavily to the bad debt. And this led to the large recession. Latin America, on the other hand, had much less exposure to the subprime markets in the US. Your banking systems were a lot more shielded from the bad debt. But unfortunately, as the economy slowed down, the global recession took hold, especially the slowdown on growth in China and in India. This led to massive reductions in commodity prices, which really affected the South American economies the most, as you are some of the largest exporters of the major commodities in the world. So I've just listed actually the few countries that actually all experienced prolonged periods of recession in Europe and Latin America from 2008 onwards. And there's a lot of commonalities. We can look there, major contractions in public financing and big pro-austerity agenda throughout Europe and Latin America, and hopefully some tangible lessons for both. So I sort of stole these images from the IMF, just showing you the countries that were in recession. So this is 2007, pre-financial crisis. So there's only a few countries there, which are the red countries in red with negative GDP growth. But by 2008, the recession took hold in Europe and North America, and it spread quite rapidly throughout the world. But by 2010, actually, a lot of countries had actually rebounded from the recession. So Europe was experiencing just above zero growth, while a lot of Latin American countries were still experiencing quite strong growth. But actually, as we move later forward into 2012 and 13 and 14 and 15, Latin America, including Brazil, still experiencing some negative growth. This is 2016, and oh no, I didn't put 2017 predicted in. So if we look at the GDP growth in Europe, so if we look, this is 2005, we can see that most countries, these are just a few I selected, the biggest economies in Europe really. No offense if I missed a few, there was no reason. And we can see that actually large reduction of growth in 2009 following recession, but if you look at countries like Greece, who had substantially sustained recessions following on, right up until relatively recently have they only gone back into positive growth. And this is the predictions from the IMF, the International Monetary Fund, for the growth in Europe. So hovering around the 2-3% predicted for the following years. If we look in countries in Latin America, we can actually see that the growth rates were substantially higher, experiencing much bigger booms. So I've actually put Brazil in the red there, so you can see sort of how much the Brazilian economy was changing. Like a lot of European countries, there were small contractions in their economies in 2009, but actually more of the crisis was felt later on, and countries such as Venezuela have had some serious problems. And you can see actually the contraction of Brazil, we're talking 4% in 2015 and 2016. So more academically, just looking at the impact of recession, there's a lot of literature and theory about how recessions affect people, affect populations, and affect governments and countries. So generally, as companies stop hiring, we're looking at higher unemployment, and we're also looking at falling wages as there's less money in the economy, people can't buy as much, they're not selling as much, so they hire people on less. And then with governments, they're getting less money in. Their tax revenues are falling as people are earning less. Companies are also paying less tax. And then they've got a more unemployed population earning less, so their costs are going up. And if you think about longer-term effect for the companies and sort of the wider economy, recessions result in reduced productivity generally because people stop investing. They stop investing in new technologies. They stop investing in their staff. So it's quite long-term impacts. And in the UK, there's a recent report that came out, 2000, saying that our productivity in the UK has not changed since around 2007. So we're still producing at the same rates that we were producing 10 years ago. So this is really having a major impact in the UK currently, and our recent budget is really struggling to get to grips with the fact that we're not investing and we're not becoming more productive like other countries are. So how do recessions affect health? So it's quite hard to really sort of try and disentangle this. There's a lot of difficulty in doing these analyses. But, it's not that crazy to understand how you think recession can harm your health. So increases in anxiety and stress are reported. A lot of people report losing social status. The loss of a job is a very damaging event. Suicides increase. There's a lot of evidence showing that mortality from accidents can go up and go down, actually. And actually, overall, that recessions and economic growth, there's a lot of theories that say that mortality actually goes up. So if we look at unemployment in Latin America, actually, it hasn't changed that much over recent years. It's been hovering around 10% to 5% in a lot of countries. But actually, in more recent years, up to 2016, you can see Brazil, unemployment has been increasing as the recession's taken hold. I'll talk quieter, sorry. But if we look in Europe, Europe experienced some astonishingly large increases in unemployment. So talking about Greece and Spain, we're talking unemployment of over 25%. And in countries like Spain, for people under the age of 25 and 30, unemployment was hitting 70%. So 3 in 4 people under the age of 30 couldn't get a job. And this was having huge problems. This analysis was carried out looking at suicide rates following the impact of recession. The blue line shows the changes in unemployment rates for men and women. And we can see that the suicide rate, which is the red line, was decreasing over time in men mainly. But as unemployment increased, we saw a large increase again in suicide rates. This was a study which was carried out looking at the impact of recession on health, and it looked at actually a lot of different causes. And this is one of the first papers to try and explore a lot of the large causes of death in a lot of European countries. So this was carried out across the European Union. And it actually showed that actually we are seeing increases in suicide rates, which is the third one down on the right. But actually, mortality declined in a lot of other causes. So really surprisingly, overall mortality during the recession actually fell. And a lot of papers now support that the fact this was actually due to reductions in cardiovascular diseases and large reductions in motor vehicle accidents. People stop driving less and they stop doing risky things when there's a recession. Also, cirrhosis, which is from liver damage, reduced. People stop drinking as much. People stop smoking as much. And actually, this has an impact on cardiovascular disease. So in recessions, sometimes people can actually reduce their risk of death because they stop doing unhealthy things. And I know when I've had a very tight bank balance, I don't drink or eat as much at the weekend. But as we sort of understand more and unpack more of the literature on recessions, there's a couple of papers that come out to show that these effects are more complicated than just that. So these are 3 really great papers which review a lot of the literature on the impact of recession on health. So in Europe and the USA, and I'm going to really note that this is in Europe and the USA, high-income countries that have quite, fairly strong social health protection schemes, we found that recession was associated with worsening self-rated health. People said they felt unhealthier. Morbidities increased, and their mental health state worsened. We also found there was increased risk of suicide, and that road traffic accidents fell. So on average, we found that there were reductions in mortality. There were some other sort of uncertain effects. We weren't sure about the effects on diet and smoking and exercise. It's not quite certain. But what's really, really important to take away from this is the impact is never equal. So actually, on average, mortality may have declined, but for certain groups, it really didn't, and it was a major problem. So unemployed people, those that lost their jobs, and those on low incomes, and men especially, we actually found that mortality did increase. We actually found that there was larger inequalities between groups following recession, although this did vary a lot by countries. So a couple of these studies always noticed that the worst impacts of recession on those unemployed, those low income, those disadvantaged groups were found where countries had limited social protection schemes. So this was a lovely quote I took out, that social protection expenditure, money spent on pensions, benefits, protecting individuals from poverty, appears to help countries smooth the effects of recession. This was a paper that was also recently published, Refat Atun's paper looking at universal health coverage and an economic recession with cancer mortality. And it actually showed that universal health coverage was protective during recessions for this mortality. So we know that social protection expenditures are important in recession. But what's interesting is how much different countries spend on social protection. So this was a report that was actually published only 3 or 4 days ago on the 30th of November, the Social Protection Fund, I think it's called that. Oh yeah, socialprotection.org if you want to have a look. And it shows, how much different countries are spending on social protection. So I put the UK in, obviously that's me, so 24%, Brazil at 14%. Countries like China are only spending 4% of their GDP on social protection. And if we then look at maybe something that's more related to austerity, to recession, the amount of individuals that are unemployed that receive social protection. So a lot of Europe do quite a good job of actually protecting the unemployed from the worsts. So they cover a lot of their unemployed with benefits. Countries like the USA and Japan and China do less well. So it's about where you're spending your social protection expenditures to protect individuals from the worst of recession. So, like I just mentioned, this is all about the impact of recession, but I'm looking at evidence from high-income countries in Europe, and we're looking at unemployment. What about countries where there is low income? And this paper just showed that actually infant mortality and child mortality decreased in low-income countries when there was recession. And this was really due to food prices. And this is something that maybe a lot of high-income countries don't really consider, the impact of large increases in food prices, which can really have major impacts on health. So I've talked about austerity, and austerity is something that happens in the economy. It's a contraction. But austerity is something else, and we want to look at the impacts of austerity, because austerity is something that we have a choice over. Austerity is a policy that is implemented by governments. So austerity is very popular in Britain, and it aims to reduce government deficits, and that can be done in 2 ways. You can either reduce the amount you spend, or you can increase the amount you bring in. But in nearly all countries, we went down the reduction of public budgets. We contracted our public budgets without bringing in a lot of extra revenue. Like I mentioned, this is a policy response to recession. But what's really important is it's about a decision on where you decide to introduce the cuts. There is a lot of choices, and you don't have to cut everywhere or in the same way. And there's a lot of variation across countries in Europe. And there's a lot of variation in how countries are protecting social protection expenditures and healthcare expenditures. So this was a review that was carried out, I think it was quite recently it came out, though I haven't got the year on there. And it was how social protection and healthcare are important during recessions. Now they are important because as unemployment increases and incomes fall, more people are reliant on social welfare, and they're reliant on the government to support them. As inequalities are increasing, there's more of a role for the governments to intervene to stop these rising inequalities. As individuals lose private health insurance, as they maybe lose their jobs or move out of the formal employment market, they become more reliant on public health services. So, and in certain population groups, as we've already explored from the recession, their health needs are increasing. Unemployment is leading to worse health for certain low-income groups. So if we looked at the UK, this was a graph. It's a bit confusing because we like to produce very complicated statistical graphs in the UK. It's a sort of our speciality. But it's really just showing the difference in government budgets between different years. So they're just comparing the governments from 2010 to 2016 and then from 2016 onwards. And you can say the real point of this and the take-home message is that there's a lot of choices about where you cut. You don't have to cut every department the same. And it's interesting, you know, they cut transport very rapidly, but then actually later on there was a lot of investment in transport when we realized that all the trains kept falling off the tracks and that nobody could get to work. So, you know, they changed how much they cut there. But so there's a lot of choices that we can make when it comes to government budgets. This is a very nice paper that was done by Aaron Reeves and David Stuckler, who do a lot of work on austerity and recession. I know they were in Florianopolis presenting this year. But what the take-home message from this paper is that the depth of your recession, how deep your recession was not associated with having cuts in healthcare expenditure. So it's sort of saying that you don't need to cut healthcare if you have a big recession. You have a choice about where you cut. So this is a really nice publication by the European WHO office. Sorry, I don't know if I'm allowed to talk about your competitors, Anata, but yeah, brother and sister. So this is a very, you know, they love to produce these policy documents, all 400 pages of policy documents. And this really is talking about how countries have responded to recession and fiscal austerity and fiscal policy contractions in Europe. So many countries did actually reduce their healthcare budgets. But actually a lot of them, reduced their healthcare much more substantially than their actual contractions in public expenditure. So in a lot of countries, healthcare was targeted for a lot of cuts. A lot of countries also tried to mobilize public revenue. They tried new ways of bringing in funds. They asked for more contributions from insurance agencies. So that might have been private insurance or state public insurance. They asked for they raised the amount of money that people were contributing. Some of them introduced new taxes. It was very popular to introduce new taxes on unhealthy behaviors. Tobacco taxes were increased, and the UK has just introduced a sugar tax. We'll be taxing soda very heavily from well, not that heavily, it's a couple of pence, but it's coming in soon. But a lot of countries always made efforts to try and ensure that there was targeting of these cuts and these new revenue-raising mechanisms to protect the poor and the disadvantaged. If we looked at how a lot of countries responded in terms of healthcare services and the package they delivered, a lot of them adjusted the amount of services that people were entitled to. So they changed benefit packages, adjusting which services. For example, a few countries in Scandinavia, I know, removed IVF or in vitro fertilization treatments for people, so they had to pay for that. So services which were costly and maybe not considered the most essential were rolled back. Some countries introduced user charges, very unpopular, and I'll show you a little bit later some of the impact of this. But a lot of them introduced costs for prescriptions, for inpatient, for primary care. In Ireland, they introduced a €50 charge just to see the GP, to see your primary care physician. A lot of countries tried to remodel how they were delivering services. So a lot of countries tried to shift care out of hospitals where it's expensive to primary care where it's cheaper. They tried to change how they were paying providers, removing from fixed-based fund transfers to hospitals and paying them more on performance-based measures or paying them with sort of global budgets to reduce utilization of certain services. There was a lot of effort in Europe to try and reduce how much people were spending on drugs and technologies. And this was done through improving how people were assessing the effectiveness of services and the medicines. So increased health technology assessments. So if we look at some of the impact of these policy responses, you know, what's good and what's bad, this graph was taken from another paper by Aaron Reeves, and this was just showing how unmet need in Europe has completely stagnated and actually started to increase in recent years. So those individuals that need healthcare but aren't receiving it was falling over time, but actually following the recession, and more importantly, following austerity in Europe, has actually shown increases. This is a paper that my group at Imperial did. We looked at how out-of-pocket expenditure for the elderly changed in Europe over time. And in nearly every single country, the amount of expenditure that individuals incurred increased over time. So I think it was only Austria and, what was the other one? So the first one was Austria, and there was another country that actually had a reduction. Or I think it might have been Italy, and they didn't actually have a significant reduction. Anyway, I can't see it. But if you look at the last column, which is the pooled countries, that's all countries together. It showed that 63% of people had an out-of-pocket expenditure in 2006 and 2007, while 80% had an out-of-pocket expenditure in 2013. So large increases in out-of-pocket expenditure. This was just a headline taken from The Guardian. In the UK, child poverty rates were at the highest level since 2010. I think that was this was in March this year. Another impact of austerity is food banks. So food banks are sort of publicly run or charity-run institutions where people can go and get food who can't buy food or on low incomes. And these are usually provided by charities or people making donations. So we can just see large increases in these over time. So let's try and sum up some of this evidence on the health impacts of austerity. So it's very difficult to try and disentangle the effects from recession and austerity because they often happen at the same time. But they are different, and as luckily a lot of countries didn't introduce austerity, so we can try and exploit the differences between these countries to understand the impact. So this is a nice paper by Martin McKee and his group in London School of Hygiene and Tropical Medicine. And their sort of conclusion was that austerity measures can exacerbate the short-term public health effect of economic crises. For example, through cost-cutting or increased cost-sharing in healthcare, which reduce access and shifts the financial burden to households. This was about the economic crisis in Greece, and I think this was quite a nice headline, from austerity to denialism. So they introduced austerity and they sort of just started denying the impact of this austerity. So if we look at what happened to the healthcare expenditure and the changes in health services between 2009 and 2012 in Greece, they reduced treatment services by 20%, diagnostic services by nearly a third, pharmaceutical costs by nearly a third. They reduced expenditure on prevention and public health by a third. Maternal and child health services received a cut of 70%. Prevention of communicable diseases received cuts of 20%. And efforts to reduce chronic diseases were reduced by 20%. So we can hazard a few guesses at the impact that this had. So austerity led to major rises in homelessness in Brazil, in Greece. So 40% rise of homelessness in Greece. Unmet net medical needs increased by 50%. We saw large increases in infant mortality, rises in stillbirths, and a large rise in suicides from austerity in Greece. And this is a nice graph looking at some of the inequalities in Greece, just showing that the inequalities in unmet needs were widening quite substantially. So just trying to sum up some of this literature on austerity, austerity has been shown to have quite negative effects on health. In a lot of countries, it's actually further contributed to unemployment, increasing unemployment as public services had to cut back how much they were spending on wages and salaries. And actually a lot of increase in mental health conditions as well. And like recession, they've negatively affected the poorest and the most disadvantaged in society. I think this is a really nice concept that was made by Sanjay Basu in the paper about austerity, which came out this year. And it's how austerity is a political concept. It's about how individuals define who should be given resources. And austerity is a political agenda about restricting access of these resources to certain people. And the other sort of element, which is sort of, the discussion which goes into the Eurozone and the Greece but also applies to those who are unemployed in recessions. Are people who become unemployed and fall into poverty, are they deserving of further ruin? So this is a political concept and an ideological debate, and it isn't a response that must occur in response to recession. But because it's a political concept and because it's an ideology, people ignore it because it's not a debate and it's not based on fact. It's based on a political ideology. So very unfortunately, a lot of people that are very pro-austerity don't look at the debate on austerity because it's an ideology. Just mentioning, trying to turn to Latin America here now, I just wanted to emphasize, the family health strategy in Brazil and the Bolsa Familia program have been shown to have major improvements in health. I'll just emphasize that the family health strategy has been associated with large reductions in mortality and hospitalizations, but it's also shown to contribute to large reductions in mortality between different groups. It's been shown to contribute to reductions in inequalities between groups. There's also the fact that the Bolsa Familia program has been shown to have large benefit on the reductions on child mortality. But what's really important, and has been shown in a few studies, is that there's a synergistic benefit of both. So having high Bolsa Familia coverage and having high family health strategy coverage have shown the largest impact than having either separately. And that's not really surprising, as they are kind of related to each other and depend on each other. So just returning to the European weighty WHO document, when you get to sort of page 300, they start making some policy recommendations for health systems in financial crisis. And I think they're quite useful, tangible lessons. So the first one is that broad cuts are inadvisable. They're really not a good idea. And that's because they never address the underlying system inefficiencies. And they often exacerbate inequalities. So what is needed is a targeted approach to cutting healthcare budgets, if you want to cut healthcare budgets. These need to be targeted to specific services and specific areas that address equity and efficiency specifically. The second thing is that user charges. A lot of countries introduce user charges in Europe, but in all cases, they were generally shown to be ineffective. They increased unmet needs. They also led to impoverishment and catastrophic payment. But what was interesting in a few studies is they showed that the administrative cost of introducing user charges outweighed any of the increased revenue that was brought in. So they actually resulted in more costs for the health system than if they hadn't been introduced. But what they do recommend are things such as unhealthy behavior taxes, increasing taxes on cigarettes, on alcohol, on high sugar, high calorie foods. They emphasize a cost-effective service approach, working out what is cost-effective within your health system, understanding where you are doing well and where you're not, and then readdressing system efficiencies that way. And they actually think that more efficiency gains can also be had through using public sector to procure more effectively in larger bulks, negotiating deals with pharmaceutical industries to purchase drugs and medicines at effective prices. A lot of countries in Europe don't do that and haven't done that and had large pharmaceutical budgets. And the last thing is maybe looking at reorganizing services, including shifting care to primary care at expensive hospital settings to try and reduce costs. So the conclusions I just wanted to rattle through slowly. In high-income countries, we've seen that on average, mortality can be pro-cyclical. The mortality falls during recessions. But that's on average. For disadvantaged groups on low incomes and that may lose their jobs, they generally have worsening health outcomes during recession. Recessions burden health expenditures and health protection schemes, yet these schemes are the ones that are often most targeted by austerity. Just want to conclude that austerity is a political concept and that it disproportionately affects the poor and the unemployed. And is actually more evidence is showing that austerity has contributed to more health system problems and challenges than the recession have in Europe. They've contributed to rising inequalities, and it's actually rolling back some of the recent advances in universal health coverage. conclusions too. Sorry, you didn't get out that easily. But in low and middle income countries, the story is slightly different. Major gains in health and social care protection could be rolled back very quickly. This is because these systems do remain weak in a lot of countries. They're not ingrained fully into the political apparatus and the health systems. The economic crises have been quite large in a lot of low-income countries and disproportionately affected certain economies. Large inequalities do persist in these countries, and actually there's still a lot of political support for austerity as well. I just wanted to say that this really, we're moving into the agenda looking at the Sustainable Development Goals and how we can ensure that progress to universal healthcare coverage is maintained, and pro-austerity policies do threaten these. So I think the last points I would say is that, it's important to take these messages to focus political agendas on some of the issues that can occur from austerity. And it's about ensuring that what we're doing is well thought out and wise. There is a need for an agenda about discussions about how we respond to recession and how we respond to budgets and look for efficiencies. But they need to be thought out and engaging and discussing all actors within the fields. So there we go. Thank you very much. And I don't know if you want to have questions afterwards, Hanata? Afterwards.
Muito obrigado, Tom. Yo quería abusar un poco del papel de moderador, primero para parabenizar a Tom pela apresentação e também para um pouco voltar à discussão da manhã, que deixamos um pouco para trás, e de como